Multiple choice question number 1.
A 3-year-old child is brought with fever, barky cough, and inspiratory stridor worsening at night. The child has mild respiratory distress but maintains oxygen saturation. No drooling is noted. What is the most likely diagnosis? A. Acute epiglottitis. B. Foreign body aspiration. C. Laryngotracheobronchitis, Croup. D. Pertussis. E. Bacterial tracheitis.
Correct answer is C. Laryngotracheobronchitis, Croup. Croup, caused by parainfluenza virus, presents with a barking cough, inspiratory stridor, and low-grade fever. Epiglottitis causes drooling and sudden airway obstruction. Foreign body aspiration has abrupt onset and localized wheeze. Pertussis shows paroxysmal cough with whoop. Bacterial tracheitis causes toxic appearance and high fever.
Multiple choice question number 2.
A 7-year-old boy presents with joint pain, erythema marginatum, and a pansystolic murmur at the apex radiating to the axilla. Throat culture previously positive for Streptococcus pyogenes. What is the most likely diagnosis? A. Acute rheumatic fever. B. Infective endocarditis. C. Post-Streptococcal glomerulonephritis. D. Juvenile idiopathic arthritis. E. Viral myocarditis.
Correct answer is A. Acute rheumatic fever. Jones criteria support diagnosis: migratory polyarthritis, carditis, mitral regurgitation murmur, erythema marginatum, and evidence of streptococcal infection. Infective endocarditis requires vegetations. PSGN presents with hematuria and hypertension. Juvenile idiopathic arthritis lacks preceding infection. Viral myocarditis presents with isolated cardiac failure.
Multiple choice question number 3.
A 2-year-old child presents with severe dehydration, sunken eyes, weak pulse, and lethargy following acute watery diarrhea. What is the immediate best management? A. Start intravenous Ringer's lactate. B. Administer oral rehydration solution. C. Give antibiotics. D. Provide antiemetics. E. Give intravenous dextrose 5%.
Correct answer is A. Start intravenous Ringer's lactate. Severe dehydration requires IV rehydration with Ringer's lactate or normal saline as per WHO Plan C. Oral rehydration is for mild to moderate cases. Antibiotics are indicated only in cholera or dysentery. Antiemetics do not treat dehydration. Dextrose 5% lacks electrolytes and is inappropriate for initial resuscitation.
Multiple choice question number 4.
A 5-year-old child presents with high fever, severe sore throat, drooling, and tripod positioning. The child appears toxic and has muffled, hot potato voice. What is the most likely diagnosis? A. Croup. B. Retropharyngeal abscess. C. Peritonsillar abscess. D. Acute epiglottitis. E. Laryngomalacia.
Correct answer is D. Acute epiglottitis. Acute epiglottitis, often due to Haemophilus influenza type B, presents with sudden onset fever, drooling, and airway obstruction in a toxic-appearing child. Croup has barking cough and non-toxic appearance. Retropharyngeal abscess may cause neck stiffness. Peritonsillar abscess occurs in older children with trismus. Laryngomalacia is congenital and presents in infancy.
Multiple choice question number 5.
A 5-year-old boy develops sore throat, fever, and neck swelling. Throat swab culture grows beta hemolytic colonies on blood agar that are bacitracin sensitive. Later, he develops dark urine and periorbital edema. What is the most likely complication? A. Acute post-streptococcal glomerulonephritis. B. Rheumatic fever. C. Scarlet fever. D. Infective endocarditis. E. Henoch-Schönlein purpura, HSP.
Correct answer is A. Acute post-streptococcal glomerulonephritis. Acute post-streptococcal GN occurs 1 to 3 weeks after Group A streptococcal infection due to immune complex deposition in glomeruli. It presents with hematuria, cola-colored urine, edema, and hypertension. Rheumatic fever affects heart, joints, and skin. Scarlet fever features rash and strawberry tongue. Endocarditis occurs after bacteremia, not pharyngitis. HSP is IgA-mediated vasculitis with palpable purpura.